It's 7:56 a.m. on a crisp autumn morning at University of Cincinnati Medical Center. Physicians and nurses pass through the second floor of the hospital as they prepare for this morning's surgeries. Today, those procedures include deep brain stimulation, DBS, in operating room number 10 for Richard Crosby, a neurological patient.
So the first part of the surgery is putting in the electrodes in the brain, right, that are actually going to stimulate those deep areas in the brain to give symptom control. But those electrodes have to be hooked up to a battery, which we place in the chest. That's what drives the stimulator.
Electrical impulses are delivered to the brain through the electrodes, similar to how a pacemaker delivers impulses to the heart. Richard suffers from essential tremor, causing him to struggle to do even basic things such as eating, reading books, or holding tools.
He had the other side done. We usually do a staged approach, so they do one side first for tremor. And he had that done several months ago and had great benefit with that. Usually patients will get their dominant side done first, and he had excellent tremor control, so he wanted to come back and have the other side done because he was so happy with the other side. So that's what we're doing now, is left hand, to see if we can get both sides of his tremor controlled.
Today, Richard's surgery is performed by neurosurgeon Juan Torres Rivera, MD, Director of Functional and Epilepsy Surgery at the UC Gardner Neuroscience Institute. Nearly a dozen specifically trained clinicians and staff join Dr. Torres and Dr. Jacob in the operating suite. 8:14 a.m. Richard is wheeled into the OR and has a stereotactic frame attached to his head, which will help guide the electrode to the targeted location in his brain. While Richard receives medication through an IV to keep him comfortable, he is not placed under general anesthesia because he needs to be able to interact with the physicians throughout the surgery. 9:14 a.m. The surgery is officially underway. Meanwhile, Dr. Jacob explains to Richard the testing she will be doing. She hands him a laser pointer to grip with his left hand and has him point to a target on the ceiling above him, which serves as a reference point. Due to his tremor, Richard fights to hold his hand still to hit the target as it vigorously shakes. Dr. Torres carefully pinpoints the target location in Richard's brain to pass electricity through the electrode. He also reviews X-rays to make sure the electrode does not move while locking it in place. With each small advancement of the electrode, Richard repeats these tasks, and the team observes improvement of his tremor.
Things are going well. We're going to try to see the location that we're in right now, take an extra shot with the film, and try to fine-tune the tremor. So his tremor is definitely improved, but we want to get it as good as we can before leaving the OR and being able to turn that stimulator on. But overall, going great. He's doing great, and so hopefully we'll get good tremor improvement, and he'll be a happy patient.
10:36 a.m. Richard does one last test with the laser pointer. His tremor improves drastically. He's able to point the laser at the ceiling and nearly hit the target. The surgery is now complete.
Great. The patient did great. His tremor definitely improved. Now when he is finished, they'll turn his stimulator back on, and hopefully then he'll have control of both sides. So he had great improvement with the right side, and again now he'll hopefully have the same level of improvement with his left hand, and we're confident that he will based on the findings we had in the operating room and the testing.
UC Health performs the most DBS surgeries in the region. On average, the team at the UC Gardner Neuroscience Institute performs 40 to 50 per year. It takes a team to perform a successful deep brain stimulation. On this morning, the team makes a positive impact on Richard's life and gives him the opportunity to have a return to all of the activities he loves.